The Manhattan District Attorney pledged $35 million to help police nationwide process thousands of untested rape kits. These kits contain valuable evidence that could be used to solve cases. Tonight, Kris Van Cleave reports that some victims are being forced to pay for their medical exams after being assaulted.
Late last year, Christine says she was sexually assaulted.
I woke up the next morning naked. I don't remember anything else after that.
She went to a suburban Chicago hospital for a rape kit exam, a medical procedure that checks for injuries and collects forensic evidence of the crime. You kept getting bills.
Correct. Lots of them, and for like thousands of dollars.
Federal law says victims should not pay for rape kit exams, but bills for medical charges like HIV tests or ER fees that are not directly part of the rape kit exam are not always covered. In some states, that means victims are getting a medical bill. Illinois, where Christine lives, is supposed to cover those costs for the first 90 days.
I would have to explain to a random person, in the billing department what happened to me and relive it all over again every time.
It took Chicago rape victim advocate Sarah Layden 10 months to help resolve Christine's bills. That's just one of 29 cases she worked on this year.
It isn't inherent to maybe one specific hospital that across the state, the rape crisis centers are seeing survivors receive bills for this.
We contacted victim advocates in all 50 states. 13 reported survivors are getting billed for medical services.
For 2 nights in a row, I was raped and sexually assaulted.
In Louisiana, this victim was among those billed after a private company took control of the state-owned LSU hospital system.
Around $2,000, of which my insurance covered none of it at all.
The Louisiana state legislature is considering whether to change the law to cover all expenses. While states tell us they have few complaints, if any at all, we found at least 7 of them have no state law to cover health care expenses. An official from Ohio told us they liken this to other crimes. For example, the state does not pay medical expenses associated with an assault. Victims are told they can apply for compensation from the state. Scott?
Important story. Kris Van Cleave, thank you very much.